Good afternoon, everyone. It is 2:30. Welcome to CCDPH Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I'm your host and moderator for these weekly webinars. Let's get started. As usual, our meeting objectives are to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide CCDPH contact information and resources. Couple announcements and updates. All of our webinars are recorded and they are uploaded onto our website as well as our CCDPH's YouTube page. The last webinars in the series have been uploaded. I've received confirmation. So you can go to those websites and use that information at your leisure. A little bit of housekeeping. I'll move this one up to number 1. Please keep your lines muted so we don't disturb others who are trying to listen to the webinar. We begin promptly at 2:30 every Friday, and our chat is disabled during the presentation, and we turn it back on for the Q&A so that we can all concentrate on what Lex or Palak is explaining to us. Here's the latest contact information for CCDPH. If you have webinar related questions or any general questions, you can send them to ccdph.covid19@cookcountyhhs.org. If you would like to send in your line list, report communicable diseases, not just COVID, or any metrics questions, you can send them directly to our communicable disease department at ccdph_schools@cookcountyhhs.org. Below you will find our Cook County Health Department website, as well as the / for the school specific website, information on our vaccine information, and there is a vaccine communication toolkit website with downloadable information if you'd like to share to use at your various facilities. For those who participate in the EpiPen request program, as you know, Keith Wynn is no longer the EpiPen coordinator for that. Please send all of those requests to me, Kelly Jones, at kjones1@cookcountyhhs.org. The requests must come from a medical professional, such as your school nurse or an administrator that is trained on the administration of medication and certified. There are several steps that must be accounted for before you can be certified to administer medication, and all requests must be typed. Cook County Health Department has shifted our focus, and we are trying to deploy a hyper-local strategy and provide information and support to the following villages that we see could use a little more help and resources. So if you are interested in hosting an event or you have some information that could help us reach these communities, please feel to reach out with the following email address. If your school would like CCDPH to put on a vaccination event, that is a possibility. You can click the link below and you can request a vaccination event at your school or event. Beginning tomorrow, there is a vaccination event in Hazel Crest, co-sponsored by CCDPH. Second shot is dated for October 23rd, 10 to 3, and they're also giving away free zipline tickets if you participate. Good luck with that. No ziplining for me. There is a farmer's market that is in Harvey. It already started last week. There's another one going on next Thursday, and then 2 weeks after that from 1 to 3. There is numerous calendars of events that are happening with CCDPH, and you can find those updates at our website. I know I explained to some people that we will be getting a vaccination event at Chicago Ridge Mall shortly. That information will be coming out soon, and we hope to have that event within the next 2 weeks. I'll spread more information when I have those flyers. If your school has an existing COVID-19 testing program, we'd like to hear about it. Please fill out the survey below. And for those who participate in that rapid antigen Binax testing, you can request the Binax at the link below. IDPH is no longer accepting new Binax requests because they are inundated with requests. So you can request those through CCDPH. However, you can contact IDPH to request shield testing. You can send an email to the following email address to set that up. If you'd like someone to come to speak to your event on COVID-related subjects, there is a Health Professional Speakers Bureau that has been created. You can find information at the Google Doc form below, and it'll ask you questions such as the language that you'd like the speaker in and any demographic questions that pertain to the event. If someone needs a ride to a vaccine, they can call the 833-308-1988 number. The vehicle will pick them up. The driver will wait until after the appointment and then bring them back home. We are having sort of a low turnout with using this information, so we want to get this resource shared far and wide if we can. And if the patient is unable to leave the house because they are 65 and older, have a disability, or use adaptive equipment, they are living in suburban Cook County, not in the city of Chicago, Evanston, Skokie, Oak Park, or Stickney, as they have their own health departments, they can also call that 833 number to request a home vaccination. More information on any resources that you may find useful. And that is it for me. I will stop sharing and toss it to Lex. Thank you all for your support.
Thanks, Kelly. Everyone, bear with me while I get this pulled up. All right. Getting into it, we just have housekeeping, the usual metric updates, some clarification on return to school or work after someone has symptoms, going over some highlights from the new decision tree, and then there were just a couple of submitted questions, and then as for references, I've kept on testing clarifications, the policy about if someone's sibling goes homesick, what they have to do, and then more on how to pick the right quarantine option for somebody. So just for your reference, we won't actually go over those. Our usual reminders, if there is an outbreak situation, feel free to contact us out of our hours. There will be an epi on call who will be able to deal with that. But otherwise, expect your responses during regular business hours because we work the same hours. And then, as Kelly said, make sure you're emailing CCDPH_schools if you have questions about COVID, if you have a weird situation you need advice about, if you're reporting cases or close contacts, or anything in between all of that. I know it can get a little complicated. And then, especially because I've had people, like parents in Cook County, find my personal information, like my actual personal information, not just my personal work information. Please tell parents or don't give parents our personal contact information. Just a reminder for that. They can email the general email if they've got any questions. And then just because people have been asking about this, Test to Stay is a great option, but it is only available if a student is enrolled in the weekly screening program at the school. Otherwise, Test to Stay isn't a shortened quarantine option. And this is a slide from last week. If you suspect that there could be an outbreak situation, try to collect information on the 2 or more cases as much as possible, like what kind of contact they might have had in the school setting, if they could have potentially had contact outside of the school setting, in which case that wouldn't be considered a school outbreak, like if they're in the same youth group or something like that, or some kind of club sport that doesn't go through the school. We want to make sure if it's school related, we're tackling that in the school setting, and if it's not, you guys don't get flagged as an outbreak. All right, moving on. We are actually slightly better in terms of metrics than we were last week. Not a whole lot, but maybe we're trending in the right direction. It's a little too soon to tell, but I'm a little bit hopeful. So there are currently 257 school outbreaks in the state. 36 are in Cook County. That's a little bit higher than we were at last week, but overall our test positivity is down. Our weekly case rate is a little bit down. You can see the curve is maybe dipping down. It's just a little bit too soon to tell. But I'm really hopeful that with Pfizer's, they already submitted their data to the FDA to review. And then I bet in just a couple of weeks they'll apply for emergency use authorization. And then since the FDA has already seen the data, hopefully we'll get the ball rolling by like Halloween or the beginning of November. And after that, we're really hoping that cases in schools will drop, which would be great. So fingers crossed for that. I'm really happy that the ball is rolling on that. And then for anybody who's on here who's got like pre-K stuff that they're connected with, that's going to be coming shortly after that. I know they just wrapped up, I think, their phase 2-3 trial for 2 to 5 year olds as well. So for travel guidance, you might have seen that there was an update to the FAQ that someone asked about last week, and we are adopting that policy. So everything is the same, including that California is pretty much the only safe place you can go right now. But specifically, if you've got an unvaccinated student, they can return to school immediately after travel, but they should get tested 3 to 5 days, but they can still be in school while they're waiting for those test results. As always, they should be self-monitoring for that full 14-day period after they return. And I mean, the hope is that this was really essential travel. They needed to see a relative in another state or something like that, not just like, let's go to the Dells for the weekend, you know. So if travel was absolutely necessary and you know that the student traveled, they can return to school immediately, and they should get tested. It does not have to be RT-PCR, it can be any test, but they should get tested after they come home. In general, if someone's unvaccinated, they shouldn't be traveling because the state of the country is still pretty orange, but I know there are some things that happen. I have relatives out of state too. All right, so just so that this is really well documented and so that I can also get your input when the chat is opened up. To be very clear, if someone wants to return to school after they're experiencing COVID-like symptoms, but they haven't had any known exposure to a case, so someone has any of the symptoms listed in the decision tree, they need a lab-based RT-PCR negative result, not a point of care PCR or a rapid PCR. But the hope is once we get the vaccine rollout for younger kids, when community transmission is a lot lower, then we can start accepting that point of care. So right now it's really about what's happening in the community, and this more stringent testing policy will become more lax as the situation in our community gets a little bit better. Or if, they're not comfortable with being tested or it's too much of a hassle, they can just stay home for 10 days and get some kind of virtual learning that way. If you noticed, we are not currently accepting in the entirety of the state alternative diagnosis due to existing conditions, like if someone's prone to migraines or allergies, or a doctor's note with an alternative diagnosis like strep throat or the flu or something. And that's because going into fall and winter, we're probably going to see a lot of people who are co-infected with COVID and something else that presents similarly to COVID. Like, I've known several people who have been co-infected with flu and COVID, and not just through my investigations. There are people who have been co-infected with strep and COVID, or have ear infections and COVID. And so if you stop testing once someone tests positive for the flu, you wouldn't realize that they could also be passing on COVID to people. So that's the reason why that is the way it is. It will probably become a little bit more lax, again, when transmission is lower, but that's how it is for now. When the chat opens up, I was hoping to get some of your input. I know that it is really difficult for you and the schools, and then also for families to figure out where to go to get RT-PCR. And I want to know, like, where a lot of these issues are coming from. Like, is it an issue with actually finding somewhere to get this test? Is it also or issues with providers not letting people know what type of test it is, or insisting that a point of care is just as good, and just trying to create something that might be helpful for you guys while we have these requirements, while we're at this high transmission level. Like, would a document with suggestions on like how to know what test is an RT-PCR that you could hand to or send to families who have a student who gets sent home sick, if that would be helpful, or something like that. If you've got any ideas or like really specific troubles with this, please let me know. I'll try to document that and see what kind of solutions we can come up with to make this a little bit easier while we're in high levels of transmission. And then this is the same as last week, but these are just some of the highlights still that I wanted to emphasize from the updated guidance, and then I'll get into the decision tree since that was updated more recently. So I just wanted to, like, while we're getting into homecoming season, if there's like a homecoming assembly or the dance or like a homecoming alternative party that's outside, if it's going to be crowded together, people should still be wearing masks. If they can spread out, that's great. But otherwise, um, according to the guidance, if you're watching a homecoming parade and you're packed in, masks should still be worn. Um, and then this next is just letting you know that probably the best test to stay test is a Binax test because you get those results right away, and that's perfectly acceptable when you're doing repeated tests. And then the next one is the policy about when a household member goes home sick, what is the standard for like their sibling who's still in school. So that's just documented there for where to find it. There's a whole other slide on it. I could barely fit the decision tree onto a single slide, so if we do need to go through it again, I'll just pull it up on my computer and share my screen and zoom in on the actual document. But this is it. Looks pretty similar, but there are a couple highlights I wanted to show. Document and zoom in so it's actually legible, but it is on this slide for you to reference, and also the link is in the slides as well. But some things I wanted to pull out and emphasize that are new. So the symptoms that would exclude somebody from school if they, turned up to the nurse's office or woke up with these symptoms: a fever greater than 100.4, a new onset of moderate to severe headache. So I want to emphasize the language here is new onset. I am someone who has chronic headaches. I wouldn't be suspicious unless the headache was more severe than it usually is, or feels different, is in a different place on my head. You know your body, and you can talk to your nurse about what would be considered a new onset. And then shortness of breath, never good, should always be checked out. New cough, sore throat, vomiting, diarrhea, very common in kids, especially with the Delta variant. It's shifting more towards those type of symptoms rather than loss of sense of taste or smell, although that is still really characteristic of COVID if that does happen. Fatigue from unknown cause. So, if someone's recovering from like Lyme disease or something, why you're fatigued. But if you can't figure out why you're tired all the time, that's a cause for concern. And then muscle or body aches from unknown cause. This is not including congested or runny nose. It is allergy season. It is cold season. If someone comes in with their nose running, it's fine. They should be practicing really good hand hygiene and mask hygiene, but they do not need to be sent home with just those symptoms. And again, emphasizing new onsets. You'll know when you feel a little bit suspicious of something. Then again, in writing from IDPH, since you've had this from us, a negative lab-based confirmatory SARS-CoV-2 NAT, which is a lab-based RT-PCR, is needed to return for someone who's symptomatic when we're in these higher levels of transmission. And then the unvaccinated household member of a symptomatic individual without a negative lab-based result yet has to be excluded within 24 hours until that negative test result comes in and can be submitted to the school. So they don't have to immediately go home if their sibling gets sick. They can finish their school day, that's fine, but they shouldn't come to school the next day unless those test results are already in. So that's kind of what that language means. And then this has been brought up. We talked to IDPH about this. The negative COVID diagnostic tests are valid for the date that they've been tested on and the next day. So that is in the language. If you've got Shield, like that means, if Shield comes on a certain day and there's a negative test result, and the next day someone's like, oh man, I've got this crazy headache, and goes to the nurses, they've got a negative test on the book from the previous day, and that's fine. I would still recommend going and getting like a rapid test or something like that, or if the headache continues, they should definitely go and get an actual lab-based RT-PCR. But if it's something they're concerned about in passing, that negative test is still good within 48 hours. And really, I think what they're trying to encourage with this is having a screening program in your school, because otherwise, like, why would you be getting a diagnostic test if you feel fine in a regular week anyway? All right, next slide. We just had a couple of submitted questions. First, can lunchroom close contacts participate in the test to stay program? And the answer is maybe, depending on the circumstances. So if the close contact and the case were both properly masked, like waiting in line to get food, walking back to class or to the lunchroom together, then if they're properly masked, they can participate in test to stay. But if they were not wearing masks because they were eating or drinking or just talking between bites and were sitting within 6 feet of each other, then that contact doesn't qualify for test to stay. So in general, the answer is lunchroom close contacts probably won't be eligible for test to stay. But if you had, eyes on someone and they were just in the lunch line or whatever, then that's fine. Second question, can an asymptomatic household contact to a positive case be released from quarantine using the 7-day exclusion guidance? And excuse me, my allergies are awful this week. So yes, they can use the 7-day exclusion guidance, but only in certain circumstances. So first, if the household contact is able to completely stay away and isolate from the case during that case's isolation, then their quarantine starts the last time they had contact with the case. And then once their quarantine starts, and as long as they're staying away from that person while they're still infectious, they can take that shortened 7-day quarantine. Or if they can't isolate from that household contact, then their quarantine starts on the last day of that case's isolation period. Because that's the last time they could be exposed. And then after that last time they could be exposed, they can take the shortened 7-day quarantine from there. So they are absolutely eligible. It just has to happen while they're not having potentially infectious contact with the original case. And then to clarify the 7-day exclusion guidance, the last exposure date is considered day 0. So the first full day of quarantine is day 1. The shortened quarantine ends on day 7. So that's a grand total of 7 full days of quarantine, maybe a little bit more if someone stopped being infectious a little earlier on day 0. A negative test result is required for this option. That's how it gets shortened to 7 days. Most people who develop symptoms within 7 days, and that's why we get this day 7 figure. So with the negative test result, the test has to be performed within 48 hours of day 7. So this means that the testing can occur on day 5 or day 6 of quarantine. So that's the 5th full day of quarantine or the 6th full day of quarantine. But it's, well, I'll explain in a second. The test doesn't have to be RT-PCR, although that is, the best test. So that's what's recommended, but it doesn't have to be. If, they go and get a point of care test, that's also okay. So I think where this gets confusing, and I literally had to write it down on a sticky note and count the days to make sure I was getting this right too. I know it's a little confusing. Day 5 is the 5th day of quarantine, but it's 6 days from the last time they were exposed. So I think that's where some of the days get into confusion, but day 5 is the 5th day of quarantine. So that is when the test can be administered at its earliest. Hopefully that clarifies it. And then I'll take a look at the chat in a second and send some questions over to Pollock, but a question for you guys, since we only had 3 submitted questions this week, is this webinar good for being like a weekly series to get updated COVID information, or would it be more useful for you guys every other week and have a little bit more time to yourselves every other Friday? Let me know. If you still want it to be weekly, we're just thinking once we actually start getting into the routine of this school year, maybe you won't need this as much. But if we're wrong, certainly let us know.
It seems universal that weekly is needed as much as the information changes.
All right, great. We will keep doing weekly.
All I see in the chat.
All right, I'm going to stop sharing. Oh, wait, actually, I think there was one more slide I want. Yeah, okay. So for testing clarifications, this was a reference slide. But something I wanted to emphasize is that if someone tests positive, but they don't have symptoms yet, but then within a few days they do develop symptoms, in other words, they were pre-symptomatic at the time they tested positive, if you're calculating isolation release dates, their isolation starts from the onset of symptoms and not the test date. And this requires, looking back to see if they did develop symptoms, but that's because, um, the tests might be able to detect them before they're actually infectious and before they have enough virus in their system to be causing symptoms. Um, and so that's why you have to calculate from the onset of symptoms and not the test date if they do go on to develop symptoms. If they don't, that's great, use the test date. All right, that was the only other bit of information I had. Let me stop sharing and then take a look at the chat. Can Binax now be used for close contact for test to stay if we are not participating in SHIELD?
Yeah, we are allowing Binax to be used. But at the same time, I do want to say that with, like, yeah, never mind. I was confusing it with something else, but yeah, Binax can be used.
Yeah, so I think just because everything cut out with WebEx for a second, Binax can be used for test to stay, and that's totally fine, but test to stay can only be used if you have a screening program in place. That doesn't have to be Shield, that could be there are other like private companies that do it, or you could have, I don't know, if you have incredible logistics at your school, be doing it yourself. But if there's not a weekly screening testing in place, then test to stay isn't an option. If that's all good and test to stay is an option for you, then Binax Now is probably the best test you could do in those situations. And then a follow-up to that, if someone has tested positive in their weekly Shield testing, what is the next step?
Well, because Shield is still a lab-based PCR, the best thing to do is to isolate the student for 10 days, do contact tracing. However, again, the context is needed because, I do know that there are a lot of students who are they go back for confirmatory testing and it's coming up negative. So it's very important for know, did the student actually also have close contact with a confirmed case, any indoor gathering, any external to school close contact. So those are the things we would also like to know as well. But Shield is, because we are in high transmission, a positive test does not, like a subsequent negative test does not invalidate the previous positive test. And this is a direct quote from IDPH.
All right, the next question I know we answered, but just for emphasis, if someone gets sent home and is symptomatic and they don't know if they've had close contact with anybody, the only test that is acceptable to return is a lab-based RT-PCR test. That's not a point of care PCR test. That's written here. It's also in the decision tree. If you look it up, it makes that distinction. So that is documented, and then it looks like you're asking if there is a place you can direct families to get tested if symptomatic, and we've been asked that a lot. I don't know if we have the bandwidth to look into it, but I'm gonna copy this down in my notes for today and see if there's any way we can look into where you can get this kind of information, and I'll let you know next week. I know that it's really hard for families to know what type of test they're getting. Let's see. Okay, that was answered. Hold on. Last week, CCDPH indicated test to stay was allowed for the bus. Is this correct?
Generally, no. But if, a family does have that, is facing a hardship about how to send the child to school, then we are allowing it. But in those very extenuating circumstances.
All right. To answer your question in the sorry, specifically Val, to answer your question, if you go into the exclusion tree, negative diagnostic tests are valid for the date in which they're collected. So, and that would be a negative results 48 hours prior to symptom onset. So there's not like a specific time that they're good for because that depends on when you got the test, but basically you have a window of 1 to 2 days that a negative is good for. Hopefully that answers your question. Let's see. Can SHIELD be used to clear symptomatic students?
No.
All right. Okay, here's a bunch of things saying for weekly. I know a lot of you are saying weekly because things changed really often. Hopefully the changes will slow down until we have an update with who can get vaccinated with Pfizer and stuff towards the end of this month, beginning of November. Hopefully we've got a whole month of like getting used to this guidance and the new routine, knock on wood. But I know it's sometimes you can get whiplash, so can the travel guidance be dropped if Illinois is also an orange state? We've been considered orange for a while. No, just because the rest of the country is also in orange. Some states around us are in a much worse state, even though they are also in orange. They're just much worse compared to Illinois. So if it's a state that is in a high level of transmission, an orange state, then the travel guidance applies.
Sorry. Actually, I was just checking and I was wrong. I would like to correct. Yeah, SHIELD can be used to clear symptomatic students. So I apologize for the confusion. It's stated.
If you guys need that documented, I'll add a slide at the end of this before we send the slides out.
I think Andrea will just, I'm sorry, Alex will just have to really like put up a slide in those so it's clear cut, and we can hopefully get the webinar posted on our website as soon as possible, just because of this new guidance that came out and it's creating a lot of confusion.
If you need something between now and when that goes out, I think the decision tree does a pretty good job of putting that into actual writing if you need that documented in the meantime.
I think the exclusion decision tree is really, really good. And, I think what happens is I do understand there are so many of these questions coming from parents and it can get confusing. But from what we have been told by IDPH over and over, and what I would recommend is just like follow the guidance as it's written. And not overthink too much.
Yeah, so a negative SHIELD result would be good for the next day if that is specifically your question. Next question, for close contacts in the special education setting, can we use test to stay when students mask but require adult support at less than 3 feet? Like adults are continuously less than 1 feet because of the support they need.
This is tricky because it's special needs. I don't think it's we would not allow that. But I will discuss this with my colleagues and I can get back to you. So if you don't mind sending me that question, so it's I can forward those emails and we can discuss.
Yep, got it in my notes, Pollock. We'll discuss it next week. Looks like we need to go into a little bit more detail about the removal of alternative diagnosis to return. This is because as we get into the fall and winter, there's going to be a lot more situations where someone is co-infected. So let's say I was a kid who had strep all the time. If I had strep and COVID, but they only tested for strep because my symptoms were a sore throat and a cough and a fever, which is the overlap there with the symptoms, they'd be like, oh, you have strep, you're good to go back to school, but I'm also co-infected with COVID and can now spread it after I return. So that's the reason they're being a little stingy with alternative diagnosis. Once we get into lower transmission rates and we're less worried that people could be co-infected, that will probably change, but that's the way it is for now while we're in these really high levels of transmission and we're spending more and more time indoors transmitting other colds and respiratory things. Next question, can you please confirm that congestion and runny nose are not symptoms that would get someone excluded? That is correct. Those will not get someone excluded. They can continue to attend school. They may need multiple masks, or you may need to provide them with more masks if they're sneezing into their mask. But yeah, they just need to practice good hygiene. Let's see. The removal of alternative diagnosis, is that going to be communicated to local providers? Do you know, Pollock?
I do know that IDPH is the one who sends this communication out. So, I mean, we do have a medical provider in our team, and I mean, if it gets to be very difficult to handle, we will definitely talk with the pediatricians or any of the physicians that are challenging this.
It looks like we just need clarification on this next one from 304. Siblings have to stay home until a negative test result comes back. That is correct. That is what's in the IDPH documentation, and that is what we are following. That doesn't mean they have to be excluded for 10 days. If that RT-PCR comes back negative for their sibling, then they can both return. Next question. Since staff need to be tested weekly if they aren't vaccinated, can we use Binax for tests to stay for staff?
Test to stay is only for students.
Yes. So you can use Binax to test your staff weekly if you want, if that's what the question is. Binax is good for that, and Binax is also good for test to stay. If you've got the supplies, use them how you see fit in that situation. If someone is a close contact who is vaccinated or they have no symptoms, do they need to wear a mask if participating in outdoor sports?
This vaccinated has no symptoms. Well, vaccinated people don't need to quarantine, right? So for close contact, so outside it should be okay. You don't need to wear a mask unless you are coming less than 3 feet in contact with the other people.
All right. It looks like we have a couple questions that we did end up answering, so I'm scrolling down. When will the CCDPH travel guidance website be updated to reflect the new IDPH guidance about students being able to return to school immediately? That is in the works. We talked about it this morning. So hopefully at some point next week that will be reflected on the website. We're also a situation where things need multiple levels of approval in different departments to get the website updated. So hang tight. That is the current guidance. It will be up on the page soon. The supplemental guidance that came for nurses and healthcare providers with the decision tree. I'm not sure what that is referring to.
I think it has to do with whether the providers were notified about the return to school, the lab-based NAT test.
All right, and I just want to let you guys know, the people who are saying they're having issues with providers having issue with a lab-based PCR instead of point of care, I am noting that we're trying to figure out like where these issues are and try to make it easier. So hopefully we'll have some solutions for you for that for next week, or just some way to make it easier. But I want you to know that's not being ignored. It's being written down and noted. How can we ensure testing will be done 3 to 5 days after travel? Many families have opted out of testing if they have a screening program.
I mean, the only thing you can do is it's the faith. You just have to know when people tell you the testing has been done. I think it's either quarantine or that for the students, right?
So I do want to let you guys know, like, we don't keep track of people's movements. We have no way to do that, and we wouldn't want to. And I know you guys don't really do the same for your students. This is more travel is more of an honor system, and something to be really cognizant of when you have like days off and holidays. I think on ISB I know they had this last year, so I'm sure it's still up somewhere, but they had a mock-up letter where you could send out before the holidays to like let parents know what the travel policies of your school are. So that's one way to do it, but otherwise it's just an honor system. Obviously, no one wants to track anyone's movements. Then next question, can you clarify that close contact can be 3 to 6 feet for students between students, but is 6 feet for adult to student and adult to adult?
Yes, and this is also in the FAQs. It's all in the guidance. So Ashley, I would recommend that just follow the guidance for the physical distancing. It's explained really well in the FAQs.
Is test stay available for staff members?
I think you just mentioned that, yes, didn't you? But my reading was, and I could be wrong unless Michelle's there, but test to stay is only for students. But Lex, I think you said that it's for staff as well.
I remember seeing that, but because I don't have the guidance pulled up in front of me, I don't want to say differently. If you don't mind, I will take a look at the guidance and have a clear answer for you next week. Sorry for the delay. But I just want to make sure I have the exact wording for you. Wow, okay, looks like we have a situation that actually happened to 2 people. I have a student who tested positive on the weekly shield screening. Parents immediately tested with a rapid antigen that was negative and have a pending lab-based RT-PCR. They said either IDPH or CCDPH, they couldn't remember, has told them if the PCR is negative, they can return. Right, so if someone tests positive, they are positive. A positive is a positive. Right now, with our levels of high transmission, a negative antigen test isn't as reliable. It's still a good test, but if it's a single time getting a rapid antigen test, it's not. It's just not as reliable as an RT-PCR. So if someone tested positive, they need to be in isolation for the next 10 days. Or if they had symptoms before that, starting from those symptoms. So even if that PCR comes back negative, it could be that they got caught on the tail end of their infection. So it doesn't matter.
But also, I would like to add that it's very important, to again find out about the risk and the exposure that the student had. So, lab-based PCR does, like CDC does state, it's a nasal or nasopharyngeal specimen that's collected, so it can be used as a confirmatory to shield. But again, this will be case-by-case basis. I do know that there are a lot of those situations happening, but unfortunately, like, there is no black or white answer.
Yeah, I know you guys are being thrust into this very crazy world during the pandemic. But typically in epidemiology, we exist in a world where tests are not black and white. There is always a range of where things can fall within medical tests. So if you're in a situation where there's all these crazy tests, and it's confusing, let us know. We will help you work through it. Otherwise, a positive is a positive, and it's as simple as that if you want to make it as simple as that.
But I think that's the next question about the black or white answer.
Why is it not black or white if Shield says they don't have false positives? Right, so if Shield comes back and says that's positive, then, you're saying that's not a confirmation test. Okay, so it is possible to have false positives, they just haven't had that documented yet. So, that RT-PCR will confirm that Shield was correct. If not, and that comes back negative, that's actually something to contact Shield about so that they can add that to their data and know about that situation. You said nasal PCR is a gold standard. How about spit PCR testing?
That is a saliva test, the Shield test. It is a lab-based PCR test, but for confirmatory, CDC does say do the nasal, like lab-based PCR, which does has a longer turnaround time, and the specimen is collected from nasal or nasopharyngeal as well.
And that's not to say that saliva PCR lab-based test isn't a good test. That's still a really, really, really good test. It's still very accurate. It's just that COVID likes to live in the nasopharyngeal area and not as much the back of the mouth. Unless, well, we'll end it here because I know we're over time again. We are receiving letters from CCDPH allowing a close household member to return on day 11 after we have told them that this is not an option as they have close contact daily with a positive parent. I guess that's not a question, but something to look into.
Yes, I think this looks like some unique situation because CCDPH always recommends 14-day quarantine. We always let the schools decide because schools know best whether whether social distance can be maintained or masking is being strict. If that is not occurring, then shortened quarantine is not an option.
Two more things before we sign off. First is that one of my coworkers sent me the documentation so that I didn't have to look. Test to Stay is available for staff if you've got an unvaccinated staff member who would like to participate in Test to Stay. So staff and students, both is fine. That's documented in, let me look. That's in the Test to Stay protocol, if you need that documentation. Then it looks like, so for Val's question, if a student develops symptoms within 48 hours of their negative Shield test, it counts as a clearance for school, or is it 24 hours? So if you look at, and I'll put this in the chat in case people haven't seen it, this is a link to the decision tree. If you look in the status column in row B, it says negative COVID diagnostic tests are valid only for the date on which they are collected. And then semicolon, specimens collected 48 hours prior to symptom onset. So it sounds like this situation, after symptom onset, or while symptoms are present within 48 hours, are acceptable for determining school exclusion. So that is correct. That 48 hours is correct. Hopefully that clarifies it. That is in the documentation. We are in line with IDPH if that is the question.
I wanted to say, thank you so much for your patience as we try to answer these questions. We are sort of, when I look at the chat with all these questions, it is easy. Just like you, we also received the guidance at the same time, so we barely had time to digest, but we are doing our best. Sometimes we do need some time to discuss with our colleagues, so we are all on the same page before we give the answer, but we are not ignoring anybody's emails or calls. It's just sometimes when it takes time, either we are trying to figure it out on our own before giving the proper answer, so we don't confuse you as well. But we really appreciate your partnership because I don't think we could handle this pandemic without your help.
I want to add real quick, of course, thank you. That was beautifully worded, Pollock. If someone, yes, that 48 hours will clear them, but if their symptoms are persistent, they should get tested again. If their symptoms went away, like they just had a migraine that day, that clearance is fine. But if they have persistent symptoms, that's something to think about having them go get tested as a follow-up to that. So just keep in mind. Wanted to add that. I will toss it back to you, Kelly. If you guys have any follow-up questions besides what we've written down to look into, send them through and we'll try to address them next week.
Actually, can I say one more thing, Lex and Kelly? We have a couple minutes. I do want to say that I do know that parents constantly are challenging. They have found ways now. They push back on the guidance. They're being really, really good at pushing back. But we do want to encourage schools to, do take a stand. Schools have the ability to exclude student. Schools can decide based on the risks that even if we give the guidance, schools can decide whether it's really a high risk exposure. So, we support you. We are there for you when the parents are being very challenging, but just we have to stay our ground, because I know they do find ways to get the kids out of quarantine. Thank you.
Thank you, Palik and Lex. We appreciate you trying to clear this up, and it is a whole lot of information to try to digest. And we appreciate all your thanks in the chat. If you guys haven't seen it, we appreciate you. We appreciate your partnership as you requested. We will be back next Friday to make sure we clear any other misconceptions up, answer any more questions you have. Feel free to send any questions to our email address. We'll try to get those answered beforehand so we can help you out and best utilize our short amount of time that we have. Thank you all. Have a good weekend. It is October 1st already. Enjoy your weekend. Have a nice day and be well.